everyone, I'm Emily. This is my pocket guide video for NU 629. I decided to use a 1-inch binder for this project to hold all of my blog entries. I did about 8 blog entries, and then I have some additional references in the back just for me to refer back to that weren't necessarily essential to have in my entire blog. I decided to tie all of the topics that we went over in class into the psychiatric field. I'm going to be the psychiatric mental health nurse practitioner. So this is the stuff that's going to be most useful for me during clinical, and then hopefully keep adding on to it after clinical and carry it on with me when I start working. So I use some different tabs on the sides. That shows all the different categories that I did, and then up top is just subcategories so that I can easily identify things. I have my table of contents here. The first section I focused on was preventative care. I just kind of went over primary, secondary, and tertiary care, and then I went over some screening tools. So working in the psychiatric field, a lot of mental health patients don't necessarily always have access to a primary care, or they might not always go see someone in addition to who they're seeing to prescribe their psychiatric medications. So I think it's really important that I can educate patients and screen them for physical conditions, not just mental conditions as well, to ensure that they're getting proper care in all aspects. So I included some screening. I focused on substance use disorder. I think this is going to be really relevant to what I'll be doing in clinical and afterwards. I included the DSM criteria. And then I also included alcohol consumption. I put the hypothyroidism screening. As I said, people may not have access to primary care to test for this, but also in addition, hypothyroidism can lead to depression and other psychiatric conditions, or it can help manifest that way, so it's important to test. We do that a lot in the hospital. So I just have put those guidelines there to refer back to remind myself. Next, I go on to the adult section. So I really focused on screening. Different things that I put was colon cancer, osteoporosis, prediabetes. I included the abuse assessment, 2 different questionnaires that you could ask patients on visits. And I put the Columbia Suicide Severity Scale here. So these are just the hot spots, the main topics that you would ask, but I put in the appendix, Appendix A, I put the full scale for me to refer back to. So this will be good and helpful for me to look at the more detailed version. But by just putting like sort of the hot spots in the beginning, it'll just be easier for me to look over quickly. Next, I put screening tools. So these are more depression screening tools. This was my mental health category. This Columbia Suicide one is a really big one, testing for suicide, but just general depression. I did the PHQ-2, which is a quicker assessment, a geriatric specific assessment, as well as a PHQ-9. It's a little more detailed. So I just think these are good options to have. Next, I move over to pain management. So this is really important because pain plays a large aspect in mental health, and how you treat it is different for everyone. So I focused on 2 different categories, medications and then behavioral health approaches. So medications I focused on sort of non-opioids, and then I put opioids as well. Sometimes they are prescribed. And then I did behavioral health approach, which this kind of focuses on different therapies that people use for pain management. Some examples: cognitive behavioral therapy, mindfulness, and biofeedback. So these kind of just explains what all of them are and examples of how to use them. Next, I move on to my women's wellness section. So this just gives sort of examples, like education pearls to explain to my patients. I focused on cervical screening guidelines and HPV education. Again, this is just the hot spots in the Appendix B. I put the full screening guidelines from the CDC just so that I can refer back to them, but this is just easily accessible. I also put breast cancer screening guidelines. I included some pictures of a self-breast exam. That's always important to teach adult women how to do that. And then if I'm teaching them how to do it, they can tell me if they find any issues, and I'd be able to refer them to someone who specializes in that to provide them further care. Next, I moved on to so these are my special populations, it says down here. The first one is pregnancy. I just kind of did different things, how diagnosing pregnancy, the signs, just so that you know someone's pregnant. Then specifically, I focused on the guidelines on psychiatric medication use during pregnancy. So I focused on antidepressants, mood stabilizers, anti-anxiety medications, and antipsychotics. This just sort of says what you should use, what you shouldn't use. Again, I have an appendix back here that says specifically like the pregnancy class that it is, what you absolutely should and shouldn't use. But these are just off the top of your head. If you're looking quickly, you know what you should and shouldn't give somebody. Another special population that I focused on was pediatrics. This just says developmental milestones. That's really important when I'm assessing someone. So if I'm working with children, I know how they're supposed to be developing properly. And if they're behind or delayed, you'd be able to refer them for further treatment to figure out what's going on. The other special population I focused on was geriatric population. So I kind of went over what the typical assessment looks like and what an atypical assessment looks like. So if you find any of these, that's kind of not your standard, so that would require more follow-up. Just different questions to look for. And then I focused on prescribing pearls for psychiatric medications to avoid in the elderly. Psychiatric medications specifically. And then more specifically, I did the Beers list, which is the full detailed list of what not to give what medications not to give to elderly patients. So that's in the appendix, like the other ones that I had. It's a very more detailed. And that's it. Then I go to all my appendix. So you can see here, this one is my Columbia Suicide Scale. So this is way more detailed. I'll be able to look at it better. This is like summary recommendations for HPV screening. Sorry. This one's the breast cancer screening guidelines for women, so a lot more detailed. This is my ACOG guidelines on psychiatric medication use during pregnancy and lactation. This is a MoCA test, so I might have skipped that when I was describing it, but it's in the geriatric. So I wrote cognition. This is how you can measure someone's cognition. So it's the whole test is laid out here for me, which is really nice. This is what they use when they test for people's cognition or impaired cognition. And then last, I have the Beers list. So this is obviously a lot of information, so I didn't feel the need to put it all in the prescribing pearls, but it'll be nice to refer back to. So I plan on adding to this next semester. I definitely think it's going to be really useful for me in clinical and when I begin working. Thank you.